Well, welcome everyone to our webinar this afternoon. So this webinar is Policy Systems and Environmental Change Strategies, Part 1. So we're doing a two-part series for you. So today we're going to talk about policies and systems. My name is Mary Ellen Kramer, and I'm a senior health educator with Hamilton County Public Health. And we also have...
My name is Kimberly Chelf, and I am also a health educator with Hamilton County Public Health. I work with Mary Ellen. So
we're going to go ahead and get started. So just this first slide we have for you guys is an outline of the two-part presentation. So as I mentioned, Part 1 today will be covering policy and systems changes. And then when we join next time for Part 2, we'll talk about environmental change programs. So today, we're going to do an introduction of all of these different terms. We're going to talk through policy change as well as talk about what system changes are. All right, so let's dive into some policy and systems changes. So the first thing we want to do is kind of provide some definitions so that everyone is kind of on the same page as we talk about policy and system changes today. So policy changes are interventions that impact law, ordinance, resolution, mandate, regulation, or rules, it being formal or informal. So they're usually written down in some form or fashion and typically adopted by some governing body. When we talk about systems changes, we're talking about interventions that impact all elements of an organization, institution, or system. It changes the way how things are done throughout the entire system. When we talk about environmental changes, we're talking about interventions that impact physical changes to the economic, social, or physical environment. These are changes that you can see, touch, or interact with directly. And then as you can see, we also have programs off to the side. And programs play an important role. So programs are events, classes, direct education, or other things working directly with the community to help increase knowledge, help understand different behaviors and how to change those behaviors. So programs could be things like health fairs, exercise classes, recycling events, or a one-time run or family day. So programs, as we'll talk about later on, play an important role. As you'll see, we focus with the We Thrive initiative a lot on those policy systems and environmental changes. So this slide, you have the health impact pyramid, and it's an important place for us to start to help kind of show why we do what we do. So at the very top of the pyramid, you have the counseling and education, which are important. These are typically interventions that are a high cost. You're working with individuals on mostly a one-on-one basis or a small group basis. So it's very focused on the individual versus having a larger population impact. These could be one-on-one counseling sessions, small group education classes as well. As we move down the pyramid, the next level is that clinical interventions. So these include things like treating health concerns with a prescription drugs or other medical interventions. We're starting to move down and have a larger population impact, but still pretty heavily focused. And within clinical interventions, we're also waiting for someone to develop a disease before we begin treatment. The third level of the pyramid is looking at long-lasting protective interventions. So these are things like vaccinations, screenings, or other types of interventions that help prevent disease. Again, we're starting to get to that prevention aspect. These are having a larger population impact, but they still require people to do something and make a choice in order to benefit from it. The fourth kind of layer in the pyramid is changing the context. So this looks at ways that we change the environment and systems around the individual. So when we talk about policy systems and environmental changes, this is where they kind of fall in this health impact pyramid. They fall within the changing the context layer. So these help people change the way they think about healthy eating or physical activity because the environment around them supports and encourages them to make those decisions. So these could be smoke-free policies in public parks, adding fluoride to the drinking to water supplies, linking healthy foods and eating to child care license requirements. And then the very bottom is the socioeconomic factors. So these are factors that affect health, including poverty, education, housing, or other social determinants of health. So addressing these factors have the largest impact on the entire population, and it can really help to impact the health of the overall community. So why policy and systems and environmental changes? I'm sure you've heard all of our, the health educators in We Thrive talk about policy systems and environmental changes on multiple times and probably in multiple meetings. So why do we kind of stress these? So first, these types of changes tend to be long-lasting. If you put in a sidewalk is going to be there for a relatively long time and only require minimal maintenance. We're really kind of creating those long-lasting changes that will be there for generations to come. Second, when we look at policy systems and environmental changes, they have a large impact. They're going to impact a large portion of the population, such as, the sidewalk example. Putting in a sidewalk benefits everyone in that community, but also then if those sidewalks connect residents to places to eat or grocery stores, it's also having an impact on the economic development of that community. And then lastly, PSE or policy systems and environmental changes are very sustainable most of the time, I will say, than kind of typical programs or interventions that we would think about. And so these interventions, these changes continue to have an effect and an impact long after that initial effort has been spent, and they make changes that the entire community can benefit from. As you'll see as we talk a little bit later about programs are important, and they sometimes are needed to help support policy systems or environmental changes. So we'll talk about that in a little bit.
All right, so the first kind of topic that we're going to dive a little bit more deeply into is this idea about policy change. And in some ways, I think it's one of the easier parts of PSE or policy systems and environmental change to understand, because I think in general everybody kind of understands the concept of a law or a rule, but policy change, like we talked about before, that can impact laws, ordinances, resolutions, mandates, regulations, rules, kind of any kind of formal thing that governs how people act or what they do. It can be formal or informal. Sometimes there are informal policies that govern a workplace or the way things are done at an organization, but oftentimes these policies are very formalized. They're written down somewhere in some kind of manual or in a law, and that's the way we generally prefer it. We always talk about, making sure these things are sustainable, and part of that is having it written down so that should there be a change in leadership or a change in ownership, that those policies remain in place. Whereas if you have an informal policy, it's a lot easier to kind of change that. And you can see, just at the bottom, there's just some various examples. There's, non-smoking policies. You can have signs that post rules at various parks. You can have idle-free policies. Even speed limits are a very, I think, common type of policy that people are familiar with. It tells you how fast you can drive on a particular road. And as Mary Ellen said, when we talk about policy changes, as with really most of the policy systems and environmental changes that we'll talk about, it operates in that changing the context block of the health impact pyramid. So when you put a policy in place, it's going to change how everyone who's affected by that policy has to act or behave or operate. So it's really that bigger picture. If they tell me that the speed limit on a particular road is 25 miles an hour, that affects me, but also everyone else that drives on that road. You don't have to go person to person and tell them how fast to drive. That policy kind of affects everyone. So there's lots of different types of policymakers. The most common one that people think about would be the government. And that's government at all levels. So that can be the federal government, the state government, the local government. They all make laws and pass different types of policies. You can also have policies made by governmental agencies. So there's governmental agencies at kind of all levels of government as well. Maybe things like the Environmental Protection Agency that has national and state offices. It can be the Ohio Department of Agriculture, the Ohio Department of Health can pass different policies, or even local governmental agencies like your local health department. Our department does occasionally have different policies that we pass or that we put in place in addition to the ones that the state has put in place and that the federal government has put in place. So governmental agencies can pass policies as well. When we think about outside of kind of the government, you can have governing boards of various organizations that pass different types of policies. So your school board, a church can have a board that governs the way that that church operates, a park. Oftentimes, if there's a park district in a community, they may have a park board that sets the rules for that particular group of parks or in a community. Lots of organizations, especially nonprofits, will have boards of trustees or governing boards that will set the way things operate in that nonprofit agency or other business. Even the Board of Health for our own health department, they set a lot of the policies on how we operate as an agency. If a business or an organization doesn't have a board, a lot of times it's that owner of the business can set policy themselves, or they may defer to the Human Resources Department depending on the size of the agency. So in bigger companies, oftentimes Human Resources will set like employee policies for how customers behave, for how what people can do inside that establishment, or the owner. If it's a small business, the owner may be the final decision maker and they can set the policies for that business. And then in some communities, there's a committee or a commission sanctioned by their council or trustees that sets policies over areas that they oversee. So, for example, the recreation department may have the ability to set policies inside a recreation center or for the parks of the community. It just kind of depends on how a community is structured. So really, what this boils down to is anybody who has the proper authority can set policy and be a policymaker. In order to affect policy change, you need to know who the appropriate policymaker is. So you need to know who you need to go to in order to change a policy or pass a new policy. So if you, for example, want to look at changing the policy around recess at your child's school, you probably don't need to go to your city council or your village council. You need to go to the school board. They're the ones that are going to set that policy. But if you're looking at changing the policy for tobacco-free parks, then you might need to go to your city council, your board of trustees, but you also might need to go to the recreation department or the parks board, depending on who controls the park, how things are structured. So it's really important to kind of find out who those policymakers are so that you can start to advocate for the changes you want to see to the correct policymakers. Along with that, there's different types of policies. So governments can pass different types of policies depending on the level of government and sort of the action that they want to put with it. There are ordinances, resolutions, and statutes, and those are generally passed by some sort of governmental body. Ordinances are something you generally see for local government, while statutes are often passed by state and federal governments. And those are all kind of things that we generally refer to as laws. They lay out some type of rule, and they often carry some sort of penalty if you don't comply. So this could be something like having a littering ordinance that you get a fine, maybe $100 or $50 if you get caught throwing trash on the ground. That would definitely be an ordinance, probably a local one, to something like having a speed limit, and if you get caught speeding, then you get assessed a ticket, and you might get points on your license. There may be different penalties that happen depending on how fast you were going, different things like that. But there's generally some sort of penalty behind an ordinance or a statute. Resolutions are also passed by governmental bodies, but they tend to be more of something that just encourages a behavior, recognizes something, brings attention to an issue. Usually resolutions don't have any kind of penalty behind them. It's more of just saying, hey, we think this is important and we support this. They can be symbolic, so sometimes people feel like they don't really matter, but they can also bring awareness to an issue and they can help change behavior. So for example, in some of our communities that we've worked with, they haven't wanted to go and pass a tobacco-free ordinance because they didn't want to have to worry about penalizing people, but they did pass a tobacco-free resolution. And that, gives the community the ability to ask people not to smoke on city property or village property or in their parks, whatever the case may be. But there's no real penalty there. So it does kind of help. You can put up signage, you can talk about it, but there's no fine, for example, if you get caught smoking. Some of the other types of policies that you can have, employers can set policies on what their employees can and cannot do while they're on the job. This can be things like regulating the length of breaks, start and stop times, conduct, dress codes, different things like that. And you can also have rules. Rules are less formal than sort of ordinances or resolutions or even employment policies, but they can be set by really any person with the proper authority to do so. A lot of times the business will have rules about how patrons can act while they're in that business. Churches and schools can set rules for, how students or congregants behave while they're in that establishment. Really, almost anyone with that proper authority can set a rule. Some rules are written down. Some are unwritten and more informal. So it may be kind of an unwritten rule at a school that the seniors, help the freshmen out, and it's not written down anywhere, but that may be kind of something that happens. Or there could be a written rule that says, there's a certain way that students have to behave. So to talk about some specific types of policy changes, we talked about that they can happen at lots of different levels. So when we think about kind of national policies, these are ones that are set by the federal government in some capacity. So Congress and the president, or by federal agencies like the Environmental Protection Agency, the U.S. Department of Agriculture, even the U.S. Department of Education. These are going to be enforced at the national level, and they're going to be consistent throughout the entire country, no matter what state you're in. The USDA's National School Lunch Program is a great example of a national policy. They set the rules for that program, and it's consistent from state to state, from school district to school district, no matter where you are. Another example that we've heard a lot about recently in the news is the Affordable Care Act. That's a national law, national policy that was put into place across the entire country. And so it doesn't matter what state you're in right now, the Affordable Care Act looks pretty much the same in terms of laws from state to state. State governments, like we talked about, can also enact policies and laws. And these will vary from state to state, but be consistent throughout each state. A good example is Ohio Department of Health sets rules for food licensing and food handling. And those are the same no matter where you are in the state of Ohio, but they can be different if you go into Kentucky or go into Indiana or go to another state. So that's something that is set by the state that they enforce, but it can vary if you cross state lines. Another example that people are often kind of familiar with, again, is going back to speed limits. The state has the ability to set the speed limit on state highways, but each state can set that at a different level. So the speed limit for Ohio state highways may be different from the speed limit in Kentucky on their state highways, but throughout the state of Ohio, that speed limit should be fairly consistent. And, you know, there's different agencies that enforce those speed limits, but throughout Ohio, if you're on a state highway, that speed limit is fairly consistent for you. When we think locally, a lot of policies are actually enacted at the local level. We tend to hear a lot about national policies and state policies, but to be honest with you, a lot of the policies that affect how you live your life day to day are passed by your local government. Things like tobacco-free parks and having an ordinance for that, or complete streets. So we always encourage communities to look at passing a complete streets policy, which requires all new streets to be designed with all modes of transportation in mind. So that would be cars, buses, pedestrians, bicyclists, people with disabilities. Anybody that might be using that street should have the ability to use that street safely. Some communities will also require sidewalks to be built for all new developments. That's a policy that's passed at the local level. Oftentimes you'll see communities that have curbside recycling policies. So they have a policy that every resident of that community has the ability to recycle their goods by putting them in a bin and setting it out with their garbage, and that's provided to every resident by the community through tax dollars or contract or whatever. That's also a local policy. So a lot of really important policies happen at the local level, things that can really affect how you behave in your day-to-day life, every day. These are just a few examples. But there's also, I mean, we've talked about a lot of other organizations can pass policies as well. So a business can have a policy for their employees that they're allowed to take a 10-minute walking wellness break for every 4 hours that they work instead of a smoke break. That would be a policy. School districts often, or always, at least in Ohio and nationally, should have a wellness policy for the district that governs a lot of things, including what types of snacks can be served at the school, different types of fundraisers that can happen, and that can really encourage healthy behaviors depending on how that policy is written. And even churches can have policies that govern how that church operates. So thinking about a policy where the church is required to donate unused food from a potluck or a church event to a food pantry rather than throwing it out. Or maybe they're going to compost the food instead of throwing it in the trash can. Those would be different types of policies. So really, while we hear a lot about those federal and state level policies and laws that get passed, sometimes I think we overlook how important local policies and even policies set by organizations, businesses, schools can be. Because these are the things that oftentimes make the biggest impact on our own lives versus some of the bigger national policies that can change the way the country or the state operates, but maybe don't have that same effect on how we do things day to day. So as we talk about making policy changes, there's sort of two things that you'll often hear, and those are, you'll hear about lobbying and advocacy, and they're different, and it's important to kind of understand the differences, because if you want to enact policy change, you're going to have to work with policymakers, and the two ways that you can work with policymakers are through advocacy and lobbying. Some groups of people are not allowed to lobby, especially if you are a governmental employee or if you work for a nonprofit. Lobbying can be restricted. So it's really important to kind of know where that line is and know what you can do as a part of your job, what you can do as a private citizen, and how you can really make a difference. Some businesses even restrict their employees from lobbying, especially on company time or with company resources. It's important to remember that all lobbying is advocacy, but not all advocacy is lobbying. So you can kind of see from this graphic that advocacy sort of encompasses a big bunch of activities, and lobbying is a small portion of that that's very specific. So Advocacy, in general, is something that everyone can do. As private citizens and in most companies, you can advocate as part of your job as well. Even as governmental employees, we are allowed to advocate for issues that we think are important. So advocacy is, like we talked about, that big bucket. So it speaks in favor of or against a policy. It argues for a cause or an issue. It supports or defends something or someone, or pleads on the behalf of others. So kind of thinking about sort of lifting up an issue to people and trying to help them understand why it's important. There's lots of different things, examples of advocacy. You could advocate for more fresh produce to be available to community residents, or maybe you want to advocate for kids to get more recess or physical activity time in schools. You might advocate for the right of children with disabilities to attend public school, or for the protection of an endangered species, or for more availability of recycling. There's lots of different things. Almost any cause can be advocated for in some form or fashion. As long as you don't link your words or actions to a specific piece of legislation, you don't communicate with a specific legislator, or issue a general call to action about a specific piece of legislation to the public, then your activities are considered advocacy and not lobbying. So it's kind of, when you cross that line is when you either talk about a very specific piece of legislation or talk directly to a specific legislator about some kind of specific piece of legislation. It's kind of the easy way to think of it. And like we said, when you lobby, you are also advocating, but you can advocate without lobbying. So a lot of the work that we do is advocacy. We talk a lot about, encouraging communities to think about complete streets and how it's important that everyone be able to utilize streets safely. But as long as we aren't talking about a specific policy that they should pass with a number or it's on the agenda, then we're not lobbying, we're only advocating for a policy like that, or to think about those things. When you start to talk about specific legislation is when you sort of cross that line into lobbying. So lobbying has kind of 4 requirements to it, and we've sort of talked about that a little bit. But it does require kind of all 4 of these things to be met to be considered lobbying. So there must be some type of communication, and this can be a face-to-face conversation that you have with someone. It can be a phone call. It could be an email. In today's day and age, it can be a tweet or a Facebook message or an Instagram message, any kind of communication that you might have. Even a letter if you're old school. And that communication should express a view or opinion about a topic or about a specific piece of legislation. And so that's kind of important. It really needs to be about a specific piece of legislation. And then you need to be expressing that view or opinion about that legislation to either a policymaker or legislator, or you can issue a call to action to the public at large, kind of a grassroots lobbying. So some examples of what lobbying looks like. It could be calling your senator to asking him to vote yes on a particular bill that's coming up, right? So I can call up my senator and I can say, I encourage you to vote yes on bill number whatever, and that would be considered I'm lobbying my senator, congressman, or my state representative, whoever that might be. If you go to a city council meeting or a trustees meeting and you ask them to vote yes or no on a specific piece of legislation that's on the agenda, that would be considered lobbying. Something that people often don't think of as lobbying, but is actually something like tweeting at the president about a piece of legislation that is, moving through Congress or that's sitting on his desk waiting to be signed. We know The president really likes tweets. If you tweet at him and say, I encourage you to sign this bill, or I encourage you to not sign this bill, that would be considered lobbying. You're communicating with him about a specific piece of legislation. Or maybe you write a letter to the editor for your local paper that's urging the school board to pass a policy. That would also be considered lobbying because you're communicating with that school board through the medium of your local paper. So even though I'm not writing the school board members directly, I am communicating with them through the paper. When we talk about grassroots lobbying, that's where you're kind of issuing a call to the general public. So if I, am someone who has a lot of Twitter followers or has a lot of people that are signed up for some kind of email, and I send out an email to them and ask them to call their congressman to tell them to vote yes or no on a specific bill, that would also be considered lobbying. Even though I'm not calling my congressperson directly, I'm asking others to do that. So you've seen that a lot recently, certainly with people, are having campaigns around a lot of the legislation that's been brought up, and you'll see different groups that are sending out emails and tweets and things to their followers and asking them to, call in and say vote yes or vote no on this piece of legislation or that. That's also lobbying. So if any one of the four kind of requirements are not met, then it's not considered lobbying, it's considered advocacy. So if it's not expressing a specific view, then it's not lobbying. If it's not on a specific piece of legislation, it's not lobbying. So you have to kind of meet all four of those requirements in order to move from lobbying into advocacy. It's also really important to know for yourself if, as a part of your job or your role in a group or a community or an organization, if you are allowed to lobby or not. So it's something you should definitely find out. If you're not allowed to lobby, you want to make sure that you follow that rule, because you can get yourself and your organization in a lot of trouble if you lobby and you're not supposed to. There are very specific rules around lobbying for especially governmental employees, government agencies, and people who work or volunteer for nonprofits. So that's something that if you're not sure if you're allowed to lobby or not, you need to ask your supervisor or the people in charge about whether or not that's something that you're allowed to do. I know a lot of nonprofits have kind of a blanket moratorium on lobbying for their employees and their volunteers, and they just say we don't lobby at all. We only advocate. I know for us as government employees of the health department, we are not allowed to lobby, but we can advocate. So that's an important question to ask so that you make sure that you know what you're allowed to do in your capacity as an employee or as a volunteer and what you're not allowed to do. The important point is, even if you are not allowed to lobby as a part of your job or as a part of your volunteering efforts, private citizens are always allowed to lobby. You just may not be able to do it in your capacity as an employee of such and such business or a volunteer for such and such organization or whatever it is. So I may not be allowed to lobby as a part of my job at the health department, but if on my own time I want to lobby for something that's important to me, I am allowed to do that. I just have to be careful to represent myself as an employee of the health department while I'm lobbying. So it's kind of a confusing gray area, but it's also really important.
So now that Kim has kind of provided a more in-depth overview of policy changes and kind of helped to explain the difference between advocacy and lobbying, which can be important tools when trying to get policy changes adopted. So the next thing we're going to talk about are systems changes. So as I mentioned in the beginning, just kind of re-going over the definition for systems changes. It's a change that impacts all elements of an organization, institution, or system, We are changing the way things are done throughout the entire system. Systems changes can often be one of the hardest kind of changes when we talk about policy systems and environmental changes to clearly identify. And that's often because system changes can be a result of policies being adopted by an organization. So you have a policy change, and then that policy change creates the systems change. And then a systems change can also then create an environmental change. So they all very much can overlap when you're talking about systems changes, and oftentimes it depends on kind of who you are in the process, as if it's a systems change versus policy or environment. So I know there are times that I still really have to think about it, and I've been doing this work for a while and really kind of think through it in my head. So just kind of keep that in mind, and if you have questions, you can always reach out to your health ed. So as we look back at the health impact pyramid that I reviewed earlier, much like policies, systems is going to be in that changing the context layer of the pyramid. So for example, if you make a systems change that allows child care centers to gain a step up to quality credit or kind of bump them into a higher step up to quality star, for implementing healthy eating strategies or making sure that they're following healthy guidelines, offering fresh fruits and vegetables and whole grains, you're most likely going to start seeing more healthy foods within the child care centers. So this kind of changing the system of step up to quality to encourage child care centers to offer healthy foods is going to then change the environment within that child care center. So again, it's kind of an example of how things can overlap, but systems change is really changing that environment, changing the context, so people start to think about the healthy choice or the behavior that we are trying to encourage with the systems change, and it becomes that default choice. So who can make system changes? So often the people who can enact policies or make policy changes are generally the same people who can make system changes. Any organization can make system changes, really, as you think about it. So this can be schools, churches, businesses, health departments, police and fire, as well as state governments, your local government, federal and government agencies. One of the things that I think is kind of often a difference of a system change is you'll have those individuals who can make a policy change, kind of adopt that policy then impacts the system, and I think often then those systems changes are implemented by kind of the boots on the ground. So, a system change within the school, so their federal government adopted a policy saying that schools had to serve a certain number of fruits and vegetables every day as a part of their school lunches. And so then that changed the system within the school districts, and any school participating in free and reduced lunch, because they now then had to offer these fruits and vegetables. So it changes, maybe where they're getting their produce from, changes how often they're requesting the produce, but that system change is most likely going to be implemented at the very local level of the school by, the school administration, the food safety or the food service coordinator, the folks kind of in the kitchen. So that's another way that I try, as I think through it, to distinguish between policies and some of those systems changes. So let's talk about some systems changes. So when we look at this first example of school sharing tables, so schools can implement a sharing table during lunch so that kids can place food that they don't want, be it extra unopened milk, whole fruit, yogurt cups, on that table, and then other kids who may still be hungry can take an extra if they wish. At the end of the lunch period, the leftover food is collected, placed in a box in the refrigerator and then is donated to a food pantry at the end of the week. So we're changing that system, that how the school district operates, allowing the students to place food that they're not going to eat, either to give it to other students or to give it to a food pantry versus throwing it away and wasting all of that food. Another example is first responders doing the DOSE program, or direct on-scene education. And so this is a systems change in terms of how the first responders within the fire and EMS department respond and act when they're on a scene in a house. So it's kind of in a non-emergency response. But kind of while they're in the house, attending to whatever that 911 call or whatever call that brought them out there, kind of looking to see if there's an infant or young children in the house, and if there is an infant, kind of making sure that there's a safe sleep for that infant, so that there is a crib, a pack and play that has nothing else in it but the mattress, so that infant can sleep safely. Ultimately, you're kind of changing the environment within that home because you are providing a safe sleep, but it's a systems change because we're changing how those first responders operate when they're on the scene, and kind of how they provide that direct on-scene education around safe sleep, and ensure that if there is an infant or a young child in the home, that they are able to have a safe space to sleep. Another system change could also be kind of businesses that hold walking meetings. And so, you're kind of changing the system or the culture within that business and organization, so that, you try to have a walking meeting at least 2 times a week. Or it's an expectation that the first 5 minutes of the meeting, you're up walking around the meeting space, or you're walking around the building, or stepping in place if the weather isn't nice out. So kind of, systems help to change that context and kind of help to change the culture within a business, a school, a community, a fire department, a police department. So that's, a systems change. Like I said, it's often it is a result of a policy change. It changes that context, changes the culture. It's implemented by program staff, the folks that are boots on the ground. And most of the time, a systems change can then result in an environmental change. So all of these are very much interrelated with each other, and rely on policy or environmental changes or systems changes. And really having the 3 of them together in various ways or contexts really helps to improve that sustainability of whatever change that you're making, and truly help to change that context as we think back to the health impact pyramid. So this was part 1 of our deeper dive into policy, systems, and environmental changes. So next time we will be talking about environmental changes and then the role of programs and how programs can help with policy, systems, and environmental changes. So the next webinar will be August 3rd from 2 to 3 p.m. If you're unable to join that webinar live, that webinar and all webinars that are part of kind of the We Thrive capacity building schedule can be found on our website. So if you go to watchusthrive.org, you can connect to our YouTube channel, in which you can see all of the webinars that have been presented. If you give us a couple days, this webinar will be up there as well. And then after the August 3rd webinar, we will post that recording. So as you listen to those webinars or as you're participating live, if you have any questions, feel free to reach out to your health educator. Kim's contact information is also here on the screen, so feel free to reach out to her, and she can help connect you to myself or to Hannah, the other health educator working on the We Thrive initiative. So thank you for listening to the webinar today. We hope that this has helped give you a little bit more of a deeper understanding around policy systems changes, and hopefully kind of spurred some ideas of things that you can take back to your own community, be that your We Thrive team within your community, to take back to trustees, to take to your school board, your church, or a child care center. So thank you for participating, and have a great day.